Welcome to the Ethos Podcast. I'm Ivan. I'm in the Bay Area today with Dr. Bryant Lin. He is a primary care physician, a researcher, and an educator. He is also a clinical professor at Stanford, a medical device engineer, and a humanist who combines storytelling at the art of patient care. In 2024, Dr. Bryant Lin was diagnosed with non-smoker lung cancer and now dedicates much of his time to teaching about his experience from a physician to a patient. Dr. Lin, thank you very much for your time.
Great, thanks for having me.
So I just want to start with how does storytelling change the experience in our experience in health and medicine as both patients or physicians?
Yeah, really storytelling to me is at the center of medicine because medicine is really about humans, making sure humans actually are, they feel better, they're doing better. We look at storytelling as a way of improving human connection. You know, storytelling is really about connecting one human to the other. And what is really more human than, you know, patients connecting to each other, caregivers connecting to patients, doctors connecting to patients. So it's really at the center of everything we do. You know, all this technology, all of these new tools, they're fantastic, but they're really just to support our human mission of taking care of other humans.
So can you take me through the story of how you came about your diagnosis?
Yeah, I had a cough, you know, for about 5-6 weeks in the spring last year. Thought it was asthma, I had a history of allergies. You know, felt a little bit of tightness, like if there was a little bit of smoke or, you know, bad air quality. Tried different inhalers, tried antibiotics. Then, you know, luckily, I'm a primary care doctor. My own primary care doctor is a colleague of mine, and we decided to get an X-ray, which showed a big mass, big opacity. And then the next day I had a CT scan, which showed big opacity plus lymph nodes. And then by the end of that week, so, you know, Tuesday chest X-ray, Wednesday CT, Friday bronchoscopy, had a tissue sample. And then by the next Monday, you know, rapid order, 6 days, I had a diagnosis, a pathologic diagnosis.
So how did you feel when you received your diagnosis?
Oh, it's, you know, everything they say is true, the stages of grief, you know. I always miss one of these stages, but they don't necessarily occur in any particular order. So it was, you know, anger, bargaining, denial, acceptance, and like I said, I always remember, I can never remember one of the five, but they happened in rapid succession, and they've happened to me a few times, but I think fortunately, for whatever reason, maybe because I'm a physician, you know, have experience with my own patients having illness, serious illness, you know, I really came to acceptance fairly quickly, probably within a couple of weeks after my diagnosis.
So what did you do on the day after the diagnosis?
No, you know, it's a process. It's not really something sudden. You know, it's not like this magic happens, right? It's really a process because I knew what was going on at every step. So I had this idea. I knew that this is a possibility. So, you know, you really become focused on the plan, what to do, you know, how to make sure you get the appropriate treatment and care you need. And it's been fantastic. I've had excellent physicians, nurses, great care team at Stanford, my own family, my wife in particular, my kids, my sister, my brother, my parents, my brother-in-law have been I'm just so lucky to have them take care of me.
Looking back, what was surprising or not surprising about the experience?
Yeah, I think, you know, I like to use this phrase, I knew, but I didn't know. You know, I knew theoretically what a patient goes through, but I didn't know. You never really know until you experience it yourself. So I think that part about living in the shoes, you know, my own experience about what a patient goes through was very impactful. I mean, I knew everything about it, but it really emphasized, you know, how experiencing it is very different than theoretically knowing about the experience. You know, I think the balance, of course, is different. You know what the balance is as a doctor. You know, you only see the patient for, you know, 15, 30 minutes, and they spend, again, small amounts of time getting treatment and imaging or, you know, other testing. Most of your time's at home, you know, 95% of your time's at home or at work and living your life day to day. So, you know, it was really enlightening me to think and to experience that, you know, really reality of living day to day with cancer. Like, what is it like to live with cancer? So that was, you know, in particular, something I wouldn't say it was surprising, but I think I came to the realization of how that balance is very different than the doctor's perception, where, when we see a patient, that's the universe, right? It's our interaction, which there's obviously so much more beyond that.
So do you experience time differently now?
I wouldn't say so, no. I think I value what I'm doing, I assess what I'm doing differently. So rather than taking open-ended projects, which I used to do, I really try to take on projects that have a more definite endpoint or, some stronger motivation behind. Like I'm devoting a large percentage of my time to raise awareness about lung cancer in people who've never smoked. Also, every day I ask myself, is this how I should be spending my day, right? Should I be spending an hour with Ivan, doing a podcast? Is this how I should be spending my time? So, every day I evaluate that. Is this how I should spend my time? And sometimes it's, I think, well, maybe I should change my schedule. But fortunately, apparently this experience has validated what I was doing before, and I haven't really changed much in my life in terms of scheduling and activities day to day based because of my diagnosis. I still see patients a day and a half a week, so 3 half days, Monday, Tuesday, Wednesday. I still teach residents Wednesday afternoon. It's a lot of fun for me. I love the interaction with the patients and also the residents and the students. I still teach classes. I still have meetings. I still help run the Center for Asian Health Research and Education. I'm also director of medical humanities. And which is one of the great joys in my life, to work in all the different programs and projects we have and educational events. Luckily it's sort of validated that I was doing what I always wanted to do. There's also another funny perspective. Some people ask me, well, why didn't you quit? Why you could go travel the world and things like that. And I said, well, first of all, my wife works, my kids are in school. During the day, am I going to sit there and watch Netflix all day, right? Probably drive myself crazy. So, it's good to be busy and productive and do something that you find enjoyable and challenging.
Did you have a bucket list before this event, and did it change?
I am not a believer in bucket lists. Yeah, I'm not a bucket list guy, and some people are, and that's great. Yeah, I'm not a bucket list guy, and part of that may be just because I've been so lucky and privileged to do everything I've ever wanted to do in life, really. So, I've traveled widely and had many experiences. So, I'm not a bucket list kind of person, really. I'd like to think about impact. Some people ask me about legacy. I don't care about legacy so much, other than my children. But I'm more concerned about, hey, what impact can I have now to help people, right? Because that's what we do in medicine.
Do you have any fears about the time you have left?
Oh yeah, fears. It's an interesting question. I don't think. I think fear is a normal reaction. I personally don't. I think we shouldn't live life with fear. I think in current day and age, unfortunately in academics in the United States, there's a lot of fear, and that's really unfortunate. I try to live my life every day with joy and happiness and appreciation and gratitude. So that's really how I live my life. I don't really, once I came into acceptance with having metastatic cancer, I haven't really feared anything. I've been afraid of anything. Am I sad? Absolutely. Sometimes I'm sad, right, for the things I may miss, for the things I don't get a chance to do. But I wouldn't say fear is a part of my life. I worry that fear is a part of our society's life in the United States at this point, which is really concerning.
What will you miss the most?
I don't, again, I don't know if that's, I don't really, when I pass, when I die, I'm not going to miss anything. I'll be dead, so to me, that question doesn't make sense to me, right? Again, I think more about sadness, right? Sadness about things I may not get to do, right? Mm-hmm. So, it's part of life. Sadness is, you can't be happy most of the time, but I am happy. Well, you can't be happy all the time. I'm happy the vast majority of the time. So, and I'm lucky to have that.
What treatments are you receiving now?
So yeah, I'm on chemotherapy with pemetrexed and targeted therapy with Tagrisso. So Tagrisso is this magic drug, which is targeted therapy. It's really a great example of precision medicine. So I have this mutation. So I have a genetic mutation in my tumor called EGFR. It's the epidermal growth factor receptor, and it's a mutation in that gene that codes for that protein. It's an exon 19 deletion, so I'm missing 5 amino acids in that protein. And this targeted therapy is great. It really is very effective for people with that same tumor mutation. And I'm grateful for it. I had 50 metastases to the brain, and now they are not detectable on MRI. So really grateful for the advances in technology and science. And hopefully, my hope is they will continue. I had a call earlier today about a possible new treatment that people are exploring. So it's very exciting, and I love the perspective of that someone told me, a pulmonologist early on said, hey, you just need to live long enough till the next treatment comes around.
That's great to hear. What do you do besides receiving medicine to support your health?
Oh, yeah. So, you got to live your life. So, it's funny. A lot of people have reached out to me and it's like, oh, are you going to write a book about your experience? And there's many things you could write about, right? It could be a memoir. It could be, it could be the class I taught on lung cancer, using my own case as a framework. And, really what seems to have resonated with me, and check back with me in 6 months, is, writing something about how to live life when you're dying, how to live life when you have limited time. And of course, you could argue we all have limited time. We just don't know that time is maybe undefined for most people. Mm-hmm. In my case, it's a little bit better defined than mm-hmm. most people, right? Mm-hmm. But I think we all struggle, or most of us struggle, with how to live our life. And, I think this experience has given me a specific insight into how to live my life and how, and maybe people will be inspired by that, maybe people won't. But, I think there's a lot of components to how we live our lives. And, I think that's a really important thing for me to reflect on, and I think for others as well.
Are you more comfortable with a more defined, like knowing when and where death will happen, or would you rather not knowing when and where it'll happen?
It's interesting, right? You could get into a car accident tomorrow, right? And you wouldn't know. And, these are things you don't have control over, right? So I don't generally worry about things I don't have control over, right? Before or after my diagnosis. I don't have control over it, right? And this is a challenge, right? Some people have difficulty with that idea. And it's interesting, in our class, our lung cancer class, we had a session on spiritual care. And a common theme among 4 of our guest speakers who came from 4 different religions was letting go. Mm-hmm. So letting go of this, there are multiple levels to letting go. What does that mean? But one level of letting go is, letting go of this idea that you have control, that there are these definite things in how your life is going to unravel. And, for many people, that's not the case, right? There's a lot of uncertainty and a lot of lack of control. I think we in the U.S., maybe have a false belief that we do have this level of control. I think also generationally, right? Depending on what has happened to you, what you've experienced, right? You can have a different level of engagement with that idea that you have control or not control, or you have some influence in a lot of outcomes in your life. And, I think that overall idea at the multiple levels of letting go is very important.
So how would you describe your relationship with death?
Again, it's like your other question about the kind of what do you miss. Death is not a person, right? I'm not anthropomorphizing death. So I don't say there's no relation. Like that's not a framework I interact with. Like a relationship, what does that mean to me? It doesn't really mean anything to me. Yeah.
Do you remember your first encounter with death as a physician?
Yeah, so, I don't exactly remember my first patient who died. I remember many of my patients who died, and I especially remember patients as a primary care doctor who have cared for many years who've died, over time you develop that really deep connection with the patient. This week, several of my patients were telling me, oh yeah, I've been seeing you for 15 years, almost 20 years. And, that's amazing. So you get to know them really well. Of course, in medical school and residency, you have a shorter relationship, and, that can be very impactful. But to me, that longitudinal relationship is really getting to know them as a person is, really important. That's part of why I went to primary care, right? I still remember, once I was invited to a long-standing patient's funeral, and she had a very small family, and I think one of the brothers or brother-in-law, had no use of his right arm, so he couldn't serve as a pallbearer, and so they were missing someone to serve, and they asked me to serve as a pallbearer. So that was just such an experience where I felt really honored to take part in this ceremony celebrating this person's life. So, there's all these experiences like that you'll get as a physician, right? I think there's definitely a different perspective when you're young in your 20s versus when you're 50, right? So, and it's not, not always, it can be difficult to understand unless, you've gone through the experience and see and figured out how it really connects to how you think. Yeah.
Do you dream about your diagnosis?
No, I don't dream about my diagnosis.
does it show up when you sleep?
No, it doesn't show up when I sleep, yeah.
So do you...
I have dreams about like aliens attacking and other things like that. Yeah, I mean, random stuff, but not about my diagnosis. Not that I remember, I probably don't remember most of my dreams.
Do you think there's a meaning to suffering, or is there a purpose to suffering?
Yeah, so this is, again, philosophical and spiritual question, right? To me, personally, no. I mean, there's no kind of overlying kind of meaning or reason. That's probably setting up too much order to the universe. But some people do, and I don't disagree with them. I don't have any basis to either say there's meaning or purpose or not to suffering. I think a lot of that's really dependent on your religious background, right? So that's a very philosophical and kind of religious framework, right? I do believe, I'm not a religious person, and we did have a session on spiritual care. And the reason I had that session was because, I really strongly believe in the impact of sharing and sharing your religion, sharing your spirituality, and supporting people in that way, in that context of religion and spirit. I know it's helped me. I've had people from all different religions say they'll pray for me, they'll pray with me, they'll light a candle for me in the church, they'll chant with me, they'll perform some sort of ceremony for me. And I've really appreciated that, and then I find that really comforting, and I honestly believe that helps me, right? Helps my health. I honestly believe that's why I'm doing so well, and I can sit here for 45 minutes and not be short of breath or coughing myself like I was at the beginning, where I couldn't even talk. I could barely talk because I was coughing so much. And so I strongly believe that part has helped me at least as much as chemotherapy and targeted therapy, at least as much. I don't know if I have any experience or background to apply any other meaning to things like suffering and things like that. And also that leads to it, the implication is, right, cancer patients are suffering, right? And you could say, yes, they are at certain points, but, I think that's a kind of also a philosophical standpoint. Oh, you have cancer, geez, woe is me, you have cancer. That's terrible. It is terrible. But does that mean, your experience is then suffering because you have cancer? To me, I personally don't experience that. Some people do. So that's where I would say, yeah, it's an interesting, everybody's different, right? And some people do suffer horribly, especially at the end of life. And that's part of our job as doctors, to hopefully relieve some of that suffering in the ways we can. But yeah, I do reject the premise that all cancer patients suffer all the time, right? I'm not suffering right now, right? I feel good.
There's a stereotype.
Although I'm a little bit hungry. I didn't have enough time to eat. So.
Oh, well, we could.
Not your fault, my fault.
There's a stereotype that physicians are notoriously bad patients. Is there
Sure.
any truth to that?
Yeah, I think there's definitely truth to that. I mean, not that they're bad patients in that, it's a joke, right? It's a joke. Well, we're bad patients. It's that we, tend to get involved in our care in the way that physicians do as opposed to patients. And that's fine. I think patients are more, honestly, getting involved in their care anyway. Which is great. They're empowered to do that. I think that difference is maybe quite getting more blurred because people have information at their fingertips. Of course, some people are very good at evaluating that information and some people aren't, right? And part of your job as a doctor is to try to help them navigate that, learning phase.
Mm-hmm. Making a segue into your career, you did an undergraduate and master's in electrical engineering and then moved on to medicine.
Yeah.
How did you make that transition?
So yeah, I think as an undergraduate at MIT, I spent time to do my pre-med requirements. So in the US, you have to do undergraduate before you go to med school. And there are all sorts of pre-med requirements you have to take before you can apply in med school. So a lot of courses. So I was one I knew I wanted to go or thought I may want to go. But I wasn't sure. I realized in engineering, you only get exposed to a certain slice of humanity, right? Other engineers, maybe customers, maybe researchers. And then, I was also interested in business. Same thing with business. You get exposed to other business people, maybe customers. I really wanted to have experience interacting with many different types of people. And medicine, especially primary care, really gives you that. You get to, in one day I can see somebody who, is unhoused and a billionaire on the same day, especially in Silicon Valley, right? Which is an interesting and interesting experience. I do believe becoming a doctor has really made me a better person. I think if I stayed in engineering, stayed in medicine, stayed in business, I would not be as kind of multidimensional a human being as I am now. I think because of that experience interacting with different people. And then, of course, I'm able to incorporate the engineering and the business as well. So medicine enables you to do that, at least in the U.S. I know in other countries it can be difficult, but, in the U.S. you can start companies. It's not unusual, especially in Stanford, to start companies, to work on other things, to do things in business. Lots of examples of people who've done that. So, I'm lucky I work on medical device startups, and I've been able to combine my interests.
So could you explain, like on 5, some of your favorite inventions?
Yeah, so I have a few patents, and one of my favorite ones was, actually was never commercialized, but we were trying to work on the problem of reducing the size of the tongue for sleep apnea. So there had been companies who used, needles and radiofrequency ablation, so thermal ablation to shrink the tissue, and those weren't that effective. So we came up with other devices. But I came with this realization, well, if we ablate the tongue, but we could do it non-invasively. So the idea is when you have like a catheter, an ablation catheter, you have an electrode, it sits on the catheter, right, on the top of the catheter, and then you've got a charge here. And the charge builds up and you have what's called ohmic heating. And the ohmic heating is proportional to how much electrical charge you accumulate. So the denser the charge, the more you'll heat. So then, of course, the heating happens here. But what if you reverse it? The tongue is this thing where you can get around the tongue. So we made sort of like a sock, and we did this on pig tongues. And we cinched the tongue in the back. And so we were able to have a big electrode where there's low density of the electric field. And then as the electricity traveled through the narrowing, the cinching point, you got a higher concentration. We were able to ablate the base of the tongue non-invasively. So I just loved that because it was such an elegant idea and it used physics. even though nobody ended up using it as a product, but I still like that. And also we set up a nice proof of concept using egg whites, so that was another kind of fun thing that I had discovered this thing that nobody else had mentioned before. So that's one example. I mean, there are many more, but yeah.
So tongue socks.
Yeah. Well, tongue ablation. Yeah.
So
your tongue doesn't need a sock. Yeah. Maybe it needs to be ablated. Yeah.
okay. So what inspired you to also found the Stanford Care for Asian Health and Research?
Yeah, so the Stanford Center for Asian Health and Research and Education is a center at Stanford focused on the university. So we have a medical center and university. It is on the university side where we're really supporting research and education around Asian health needs. And part of what inspired me is I had a patient. He was a great, super nice patient. He had recurrent gout. And this is an inflammatory arthritis. So you had these crystals deposited in the joint, cause a lot of redness, swelling, warmth. It'd be very painful. And he kept having gout episodes, and I gave him a common medication called allopurinol to prevent these gout flares. Unfortunately, he had a severe skin reaction. And in the U.S., we're not really trained that people of Han Chinese descent can have these severe skin reactions. And so he didn't blame me. He said, hey, we should raise awareness for this. And I said, well, there's so many things I know about that differently or disproportionately affect Asians, right? Stomach cancer, lung cancer in never smokers, normal weight diabetes, cardiovascular disease in South Asians. So I reached out to my colleague, Dr. Latha Paliniappan, and who's an expert in the area. And I had no real background doing research in the area. And she it was a meeting of the minds. She loved the idea, and we worked together to build this center, and it's been surprisingly successful. So I'm really happy that that's the case. And you yourself did our summer program, which is really honestly a year-long program, but you start in the summer. And it's been such a joy to see graduates of that program. People who've received our seed grants. We have a journal. We hold meetings, summits. We had a lung cancer summit last week. It's been very satisfying to see the impact.
So one question I've always had was, why is Asian health under-researched if Asians make up a dominant majority of
the world? Yeah, 60% of the world's Asian, but of course, in Asia, as you're from, Hong Kong, right? People don't think of themselves as Asian, right? It's a little bit of an artificial construct that we use in the United States. So we have many subgroups in the U.S. that are represented by Asians, but only 7% of U.S. are Asians, right? But there are many subgroups, right? People of Chinese descent, Indian descent, Korean, Japanese, Filipino, et cetera, et cetera. So we use that as a way to unify us in the U.S., but we want to study Asians throughout the world because there are a lot of insights you can get looking at diaspora populations. Most of the research, fortunately or unfortunately, medical research in the world is done in the U.S., predominantly funded basic research side by NIH, but also by companies and looking to develop drugs. And, part of the reason for that is the U.S. is a huge market for drugs and medical devices. So a lot of the research gets done here. So what ends up happening is then the studies are reflective of the U.S. population, not the world population. So, it's been great to see China, India have increased their research rapidly. And it's fantastic, but the maturity of the research ecosystem in the United States is really quite advanced, and it's great to see the whole world though advancing, and with advances in AI, biotechnology, and of course Europe, mainly non-Asians. So that also adds to the mix. Any study done in Europe is again not a majority Asian, but especially in lung cancer, for example, in lung cancer non-smokers, there's a lot of work being done in China looking at this, and a lot of new drugs coming out. So it's very exciting. But yeah, we I think fit a nice need, and the Bay Area, San Francisco Bay Area is really a great place to have a center like ours because 30% of our patients, 30% of the population are Asians, and we get Asians from all around the world and multiple generations. So it's a great place to study challenges to the Asian population.
So making a little segue into patient-physician relationship.
Yeah.
How do you break bad news to a patient?
Sure. So this is again, challenging. Can be challenging to young physicians and older physicians. I think, but for the most part, don't have their own approach and they develop their approach. To me, it's about being direct but gentle. You don't want to beat around the bush. People hear what they want to hear, right? So you want to be direct and realistic, but again, something I've learned from having cancer is you still want to help patients maintain that hope. So that's how I do it. There's no right way or wrong way. I think you learn many different techniques in medical school, but I think the key is to have experience doing it, right?
How do you define a successful physician-patient relationship?
Yeah, again, these are always these interesting things. When you do a study, you need to find metrics and things like that. I think if both sides find it successful, that's what I would say. If the physician finds it successful and the patient finds it successful, then you've got a success. I think it's simple as that.
So on to a much deeper question. What do you like on pizza?
So pepperoni. I do like these, all sorts of new pizzas now. I think a deeper question is like, what style of pizza do you like? That's a deeper question. So, do you like the super thin crust, Neapolitan style? Do you like the slightly thicker New York style but still very thin Detroit pizza? Sicilian grandmother's pizza. That's an interesting question because the styles are very different. The toppings, kind of depends on what you like, right? I think the style of the pizza is interesting. Maybe in Hong Kong you don't have as much variety, but now in the U.S. we have so many different styles of pizza. And I definitely like the thin Neapolitan pizza. I make my pizza at home. We've got a pizza steel. I didn't buy a pizza oven because it was just too much. And we make our own, and I like to make dough and make bread and so forth. And then in particular, I do like the Detroit style, kind of thicker, softer bread, a little crispy, kind of oily crust. And then, they also put the cheese and then the sauce. I don't know, it doesn't matter to me too much, that part, but I do like me some thick pizza sometimes. But not a huge fan of the pan pizzas like Chicago, because it's a little bit too heavy sometimes.
Oh, I tried it recently.
Yeah.
It was, I liked it though.
Yeah, it's good. Once in a while, yeah.
What's a small everyday thing that brings you joy?
Everything brings me joy. So I was driving here and there was a new ID Buzz electric van, and I thought about getting that, and I was like, oh, that's so cool. I love that. I saw the Stanford adopted electric buses for the Marguerite shuttle, the shuttle that brings people around campus. And I thought, oh, this is the cutest thing. I looked it up later. So, to me, there's lots of joys in life. And, people talk about small joys and big joys. And there's just, these books people talking about, write down these small joys. To me, they're not. They may be small things, but to me, they're not small joys. A joy is a joy. You find something enjoyable in life, find it amusing, find it, gives you happiness. That's fantastic. I wouldn't call it small or large. I don't know. Yeah, I don't know if I think in life we tend to be, and maybe it's America, we tend to be obsessed with quantifying things, right? Oh, this is better, better, best, right? Good, better, best. I think if you approach life differently, maybe that can change how you look at happiness.
What entertainment or fun thing have you planned for yourself in the coming months?
Oh, so yeah, we're going to take a trip to Japan I missed my sabbatical this summer. We're going to take a trip to Japan for at least a month, so that should be a lot of fun. Haven't been there in years. Love Japan.
What role?
Hong Kong's too hot, though. Maybe, but Japan's also hot, yeah.
How do you maintain such a optimistic outlook?
I mean, part of that's just inherently who I am, right? And part of this is kind of why I think people are encouraging me to write about this aspect, like how to live when you're dying, right? And maybe we should just say, maybe it should be just how to live, right? Of course, people have mental health challenges, and that's difficult, right? I've been lucky; I haven't had those. So definitely, if you're not happy all the time, or if you're sad or you're depressed, seek help, get help. But for people who are not clinically depressed, or to me, I think happiness and joy is really about it's really about engaging in life and And having that day-to-day presence, I mean, you don't want to ignore the future, right? But really, just, being curious, being grateful, right? Being creative. And sometimes it also just means sitting there and doing nothing and just enjoying the moment. So I think there are many different ways. It's not I don't know if that's I don't have a simple thought of, oh, this is why I'm happy all the time. I don't think that it boils down to that, but I think there are many different ways we can all, get joy and happiness every day.
Do you read into any philosophical camp like Stoicism or?
No, I mean, I'm first of all not really well read about philosophy. I just know how I live my life and what I've observed in people, my friends, my family, but also patients.
What's a question you wish people ask you more often as a patient or person or a doctor?
I don't know if I have that. I think I do wish, with patients that, I wish we had the time to talk about them as a person as opposed to a patient. And, like we're doing today, right? To have that time would be great, to learn about people because, again, this is a human being. It's not a patient, right? It's a human being you're interacting with, right? You're trying to help in some way.
How are you feeling today?
I feel great. $1 million.
Well, Dr. Lin, thank you.
With inflation, sorry. $1 billion.
Dr. Lin, well, thank you so much for joining me here today. Your time is so infinitely precious, and you're so generous to come out here to talk to me from like a student from halfway around the world. And you're very, very inspiring for coming out in a time of crisis and teaching about your experience. So thank you very much. Thank you a million times.
Thank you for having me. And like I said, if I didn't want to do this, I wouldn't do it. So, I find it helpful. I mean, if people find it helpful for me to share my story, I will continue to do so.
Thank you very much.
Great, thank you.